what's up guys? This is Dr. Girmann, and today we're talking wrist pain, and specifically Quervain's Tenosynovitis. That's a mouthful, so what does it mean? Quervain was the Swiss surgeon who named it. You better believe I Googled that one. And Tenosynovitis just means inflammation of the tendon and the surrounding synovium, specifically in this area of the wrist. Hopefully you can see that. But what I drew is the two tendons involved in this condition, and they sit within the first dorsal compartment of the wrist. So all of the tendons on the backside, or the dorsum of the wrist here, sit in one of 6 compartments. And you can see that in this picture from a publication, and we're looking specifically at this area. You can see those 2 little circles sitting in that compartment. So which are those 2 tendons? This first tendon here is abductor pollicis longus. It moves the thumb this way. And the second tendon is extensor pollicis brevis, which brings the thumb back. So for the medical students and the residents, there are a lot of extensor and abductor and longus and brevis tendons in the wrist. So how do you remember which is which? I like to remember apple. Apple is the first tendon. And what do I mean by that? APL, abductor pollicis longus. And the other one in that compartment is the opposite, meaning it's not an abductor, it's an extensor. And it's not a longus, it's a brevis. So we've got APL and EPB. That probably only makes sense to the medical trainees there. But what happens in this condition? What occurs is that you get a lot of repetitive motion at the wrist, and therefore inflammation and irritation of those tendons. And so patients will come in with pain in this location. Sometimes it radiates up the forearm or down into the thumb a bit more. And we will often, during our exam, do what's called a Finklestein's test, where we'll have them grasp the thumb in their fist like this, and then engage in what's called ulnar deviation, where they bend the wrist this way. And you can see how that would cause stress, excess stress on the tendons, and that's painful in these patients. So how do we treat it? Well, first, since it's an overuse type of syndrome, we'll want to decrease their repetitive activity. And a lot of times in the course of limiting the motion, we'll try a brace, something called a thumb spica splint that decreases the movement specifically at the thumb. We can also try topical or oral anti-inflammatory medications. If symptoms, though, persist, we can safely do an ultrasound-guided injection into that first dorsal compartment so that we can bathe those inflamed tendons and the synovium in anti-inflammatory medication. That tends to be pretty successful. The research papers will say that with the first injection, about 50% of patients will get great results. And then if symptoms persist, another 40% after that will get great relief after a second injection. I agree, in my clinic, people tend to get great relief for that. I've also tried platelet-rich plasma in some patients, and that seemed to be quite effective as well. For those with very persistent symptoms that are refractory to all those other treatments, sometimes we'll have to consult with our colleagues in the hand surgery department, and they might have to do a release of that compartment, similar to a carpal tunnel release. We have a patient who's become a friend, actually, and she owns a salon, so she's routinely using hair dryers and scissors and whatever else they use in salons. So she had a lot of repetitive motion at the wrist, and she ended up having to have a release of that compartment. So I'll show you a picture of what this condition can look like on ultrasound. I pulled this from the Inertia Medical Facebook page, and hopefully you can see, if you zoom in, that on the top, in the normal patient, the green indicates the thickness of the tendons in that first dorsal compartment. Whereas on the bottom, in this patient with Quervain's Tenosynovitis, it's much thicker, as seen in red. So you get hypertrophy or thickening of the tendon and surrounding synovial sheath, which is indicated by this blue sort of envelope around those tendons. So that's it. Quervain's Tenosynovitis, very, very common. Many ways to treat it. The treatment is often quite successful. If you have any questions about this in particular, let us know. You can email us at info@inertiamedical.com.